My name's Sean Begley. I'm 42. I'm an engineer, an electrical engineer, and these days I write software for a living. So I spend a lot of time at work on my computer. But in my free time, I like to go rock climbing. I like to go canoeing and camping, and go explore Oregon with my family.
And the reason why we got to know each other is because the downstream effects of something that happened in November of 2024, as I recall. What was that?
Yeah, so for most of my adult life, in from really in my teens, but especially in my early 20s, I started struggling a little bit with back pain. And it was manageable, and every couple times a year I might throw my back out for a week, but it was okay. And then come 2024 November, I threw my back out, and it just didn't heal. And a week went by, and then 2 weeks, and then a month, and then 2 months, and that began, my latest exploration into how to deal with this. And that meant seeing some physical therapists, meeting with a surgeon, although I didn't get surgery, meeting with a pain management clinic, which led me to you.
And yeah, your referral here, as I recall, was from a pain management clinic with another physician that has experienced the work that I do as well. So yeah, that encounter, as I recall, was about 9 months ago when we first started working together.
Yeah.
And during that work, talk a little bit about what you could and could not do at that particular point, because at that point, I think you had a radiofrequency ablation of the nerves that service the facet joints. And did that give you some benefit?
It did. Basically, prior to that, for the whole, 3 or 4 or 5 months that I spent really debilitated, I couldn't sit in a chair for more than 5 or 10 minutes. I couldn't stand for more than 5 or 10 minutes, and I couldn't walk for maybe more than like 15 minutes. And so I spent a lot of time switching positions. I was fortunate enough being a computer programmer that I could lay in a bed and mostly do my job. So that was, I kind of got myself lucky there, but I was really questioning what the rest of my life looked like because I could not do a lot. Um, I did get some relief from the radiofrequency ablation. It basically took care of the most debilitating piece of my injury, which was these lightning pain feelings in my lower back that happened pretty frequently, that would sort of lock up my whole body and make me feel like I need to lay down, like right where I am, whatever it is, or I'm going to have horrible consequences. Um, and so that was definitely beneficial, and I think it allowed me to start doing a few more exercises, but it certainly was not solving the problem. And if I could only sit in the chair for 5 minutes before that, maybe I could sit in the chair for 20 minutes after that. Better, but not sufficient for the lifestyle that I wanted to lead. Even with work, I could work for 20 minutes and then get up and take a walk around the block, which in hindsight was, all filled with continual pain.
So talk to me a little bit about where that takes a person's mind. I know where it takes it in some ways because I've had it myself, this injury that is. But give me a little insight on where that took your head and what that does to someone as a provider for their family, a father of children, a husband, etc.
Yeah, that's right. I've got 2 kids and a wife, and I had an active lifestyle. We actually had just moved to Oregon just about a year before that, specifically to have more of an outside lifestyle. And we picked Oregon specifically to engage in more of that outdoor exploration, which we knew we loved already, but this was a better place. And so then this happened, and my wife is a stay-at-home mom, so I'm kind of like the sole breadwinner of the house, and I need to be able to financially support my family. And then I have always been a person that prided myself on my physicality and being robust and durable and being able to do things. And I started to have to consider, like, maybe I have to reinvent my whole self and take these things that I thought were important to me and put them somewhere else and figure out a new way to feel, like a person. Um, and so it was pretty dark because I spent, months before we got together, making very, very little progress. And I'd spent, really decades prior to this with less problems, but still with the same type of issues, trying to deal with it and improve things and not getting a lot of satisfaction, seeing a lot of different physical therapists and getting fed sort of a lot of cookie cutter, remedies and procedures and exercises to do, but never really getting all that much benefit out of it. So I was, it was pretty depressing, really, when it's all said and done, because I just didn't know what the rest of my life would look like, which, I planned on living for a little while longer.
So the things that that are on the Fix Your Own Back website are they're reflective of the way that I've adapted over the years of integrating a variety of different evidence-based protocols for the type of injury that you had. Now, we saw each other clinically for that, and I'm using the Fix Your Own Back system personally with you. We've done that now for 9 months. You came in today, you had some pretty cool things to share with me about your physicality now and what you can do. Why don't you tell me some of the things that you're able to do now that you couldn't do 9 months ago?
So I'll tell you, 9 months ago, I literally couldn't pick up a pencil off the floor because I couldn't physically bend over and do that. Today I came in and told you that, I finished my weightlifting exercises for the day. That included 25 reps of deadlifting 155 pounds, doing body weight plus 40-pound pull-ups, doing Bulgarian split squats with 40-pound weight. And also I told you that I am my son's lacrosse coach. And, now, which wasn't even close even before the injury, I was wearing a back brace at practice, like a weightlifting type of, like you would wear if you were doing construction or something and moving boxes, and still stopping, 6-7 times of practice to lay on the ground in the grass and stretch and just trying to make it through that on Advil, on Salonpas patches, But now I go to practice and I demonstrate movements for the kids, and I pass to them for an hour and a half with, rotational movement in my body, and I do that without painkillers, and I do it without any kind of patches or anything like that, and it's going great. So really, I've seen continual improvement over those 9 months, and I'll admit that for a while there, I kept thinking, oh, is this plateau? Is this the best I can do? Okay, now I can do this. Maybe I've reached the pinnacle of what my body's capable of. But in the last month or two, I've really come around to the idea that the sky is the limit for where I can take this. And certainly it was necessary to have my personal experience of continuing to break through the next boundary and lift the next weight and do the next activity. But a lot of the things that we discussed and that you sort of clued me in on, and some of the other, mind-body things that you directed me towards, helped to explain what is going on here in a way that was different and more realistic, or accurate anyways, than just what I thought, which is I have a physical injury and my MRI shows this result, and therefore I am chained to this, diagnostic image for the rest of my life.
Personally, I look forward to seeing what you turn into when you grow up.
That's right. Not I grew up, but we're doing it all over again.
All right. Well, keep up the good work, man.
Thanks.